Welcome, everybody, to the first Backfitpro podcast. Believe it or not, this is the first one I've ever done, having been the subject of many podcasts. I'd like to introduce one of my fabulous colleagues here at Backfitpro, Dr. Ed Cambridge, a master clinician who did his PhD with us quite a number of years ago now at the University of Waterloo. And I enjoyed working with Ed pretty much every day in the clinic for about 6 years. So with that introduction, I'd like Ed to tell us about himself, probably the days before we ever met, and I'll talk about your skills after that, once you tell us about who you are.
Well, thanks, Stuart, and thanks for having me on the interview today. It is kind of fun to see you're on the other side of the equation here. But anyway, yeah, I guess I would start with my interest in back pain in general. It came from my own experience playing competitive volleyball. In fact, I played on 5 teams a year, making Ontario Summer Games teams and school teams and club teams. And my high school had a concrete floor gym. And so that constant barrage of jumping and landing on a concrete floor without any suspension or give led to a little bit of an overuse injury in my back. And I sought treatment for it. And that's really what got me inspired to become a clinician and help people with their back pain. But along the way, I noticed this large gap in what we know and what we ought to know to help patients with their backs. And so while I had some successful treatments and continued to play and manage the back troubles, I couldn't help but think there must be a better way than ongoing treatment and some way for me to help myself with my back. And so that, of course, after my clinical training at Chiropractic College in Toronto, led me right to Dr. Stuart McGill's lab at University of Waterloo. And as a matter of fact, I kept the message you sent me on the phone when you gave me the results that I'd been accepted to the graduate studies program on my answering machine for about a month, and thought it was a bit surreal that I had been accepted into the program. So I was a bit starstruck and a bit overwhelmed by the whole process, but quite excited at the same time. And that led me to work out a PhD with you at University of Waterloo.
I remember that, Ed, and I should say, back in those days, we would get quite a number of candidates applying for PhDs, but I learned I had to meet the person who I was going to spend every day of the next 4 or 5 years with. And I knew right away that you were a humanist, you cared about people, which is huge, but you also had the clinical reasoning. When I would ask you questions, it was quite often you didn't know the answer, but you would discuss ways on how you would investigate the issue and converge on the answer, which is exactly the attitude that I'm looking for someone who can stand. And it's a pretty intense 4 years. I think you will agree with that.
Oh, absolutely. It was there was some trying times, but you know what doesn't kill you makes you stronger.
Well, after you finished your PhD, which I'll mention this, it was really a synthesis between hip mechanics and spine mechanics, which we know clinically can be very important for unlocking the understanding of a particular puzzle presented by a person. We don't get easy patients or clients. We get people who've failed many other clinicians. So we have to be a little bit different. But once you graduated, can you tell us a little bit about your journey to becoming a master clinician and a instructor of the Backfitpro approach?
Well, yeah, and it really evolved over time. It was a synergy between the PhD work I was doing with you and quite evidently a bit of a surprise to see how much clinical knowledge I would pick up during my PhD. I went for the academics and ended up getting a nice synergy of both clinical knowledge and academic research knowledge. And so that started to build quite organically. I remember in first year, you invited me down to see a patient with you, and I jumped at the opportunity, of course, and it went quite well from both perspectives. I did a lot of watching and observing, and watched you work, and before I knew it, it was the next week, and we were watching some more patients, and it just snowballed from there. And it was such a great experience that I really wasn't anticipating when I signed up to do PhD work in the science laboratory. It was very nice and very refreshing to see the two synergies between the academics and the clinical work coming together so nicely. And so then it just snowballed from there. And eventually, after actually about 3.5 years, I think, you sent me my first patient and said, Ed, well, I'm getting so busy. Why don't you see a few for me? And that just snowballed again. I did the assessment as I believe you would have done it. And it was a 3.5 hour assessment. And I took my time to sort out the patient's main issues and how they were struggling. And unfortunately, as they always do, they get to me with how many clinicians they've been to see, which have had no success or haven't given them the time to sort out the problem in the first place. And that never ceases to amaze me, by the way, on a side note. And I was getting such great results with patients who had failed so many other attempts. I knew that this approach would be have some serious longevity to it in terms of a clinical practice. So I jumped in with both feet and switched my practice over to a consultant-based sort of difficult cases. As you mentioned, we don't get the easy ones, but we sort them out. We take the time it takes to sort them out and work with them. So it's very rewarding practice for me now that I work with these patients on a daily basis.
I have mentioned this to you many times, Ed. In those early days, you taught me a lot as well with your clinical training. And particularly, I began to appreciate the neck and how skilled you were in sorting out through your cervical spine assessments, and how sometimes those are pieces of the puzzle that transfer through the linkage. What is a joy for me is when patients come to Backfitpro and they see the various master clinicians around the world, and they then go and seek an appointment with that. And I know you get many of our referrals, particularly since we live relatively close to one another. And then they give me feedback that you not only converged on an understanding of their back pain like no other, and were able to address it very specifically, but that gave them such a powerful psychological empowerment, I guess we'll call that.
Mm-hmm.
Can you speak on that a little bit? This idea of changing people's lives beyond just the pain in their back.
Yeah, in fact, two particular cases come to mind. One was fairly recent, I would say within about the last year. And this individual came in and was completely paralyzed by the fear of movement. And all that they knew was while their back went out, they experienced debilitating pain for a moment in time, and all they associated that with was moving. They didn't categorize what type of movement, what they were doing at the time, And immediately, psychologically, they associated movement with pain. And as you could imagine, with that type of linkage, it became a very strong desire for them to avoid movement at all costs, for fear that they would have this lancing, shooting pain that was quite debilitating. And so when I started to categorize their movement capability and competency, and really identified what the triggers were, and in fact, going back to what you mentioned about my PhD work, and obviously what work you've done with the hips leading up to that, and showing them that while their pain happened while they were lifting and twisting, if they changed their movement pattern to allow them to, say, pick a box up off the floor or pick a laundry bin up off the floor using a hip strategy, they didn't have to worry so about such a catastrophic event happening again, because they now had the empowerment to understand this only happens in this confined circumstance. If I can eliminate that or avoid it by using a different joint or a different linkage, then they were quite robust. And it was such a contrast with that particular individual. He was about a 50-year-old male, and he sat down and he said, "I can't believe what you've showed me already today." And this was just in the assessment part. We hadn't even got into the real coaching session yet. But he was just fearful of sitting down and moving over to the exam table and all of that. It was quite shocking, of course, because he'd been, I believe, to see more than 5 clinicians at that point. And I couldn't believe that no one had spent the time to show him how important his movement patterns were, and just to eliminate his fear. And he turned at the end and said to me, "I have my life back. I can move again." And I said, "Yes, you can. And here's how you do it with the tools that we've discussed today." That one really stands out. And one other case, if I can mention it quickly, was there was an individual, and this was a very specific example. He only feared going to the toilet because he had to wipe himself after going to the toilet. And it was a very, specific situation where he would feel his back pain after having a bowel movement. And again, showing him how to use the linkage, mocking it up on a stool in the clinic, he turned to me and he said, "Do you know what this means to me?" And I said, well, tell me." And he said, "This means I don't have to call my wife in after I'm done to clean myself up." And at that time, we both had a few tears shed, because his wife was there in the consult with him, and this man just restored his dignity through a very simple movement cue that should have been taught to him years and years prior. But these are the types of ways that we change people's lives, and it's so enriching to me to hear them give feedback and be so appreciative of what we do. And we're just trying to sort out the cause of their pain and how to avoid it and mitigate any risk of further injury.
Yeah, well, how many years has it been now that you've joined me on the road teaching courses? Well, pre-COVID, of course.
Yeah, geez, it would be more than 8, I think now.
Yes, and the feedback that we've received over the years about your teaching skills have been outstanding, and people will get a flavor of that listening to you now. So now we're in this post-COVID world, and a lot of people are asking, well, are you putting on the courses live once again? Because the courses are online. And we are moving to this hybrid model where delegates will take the courses online, but there's no need for me to be there anymore. But you and another of our master instructors, Joel Proskowitz, will be going to the various countries and teaching the hands-on skills live, because it's the only way to do it. And you've given a few examples today of the assessment moving into creating a plan specific to the pain triggers and various pathologies, and then coaching the person into a series of movement. We'll call them movement flows. And this is something that we're going to do a better job at formalizing. But in any case, do you have any comments about getting back out onto the road once again and teaching the various hands-on skills?
Well, I'm so looking forward to it. And I think, as you mentioned, the hybrid approach will be fantastic. Our delegates will still be able to get all the time listening to you and hearing your clinical stories with professional athletes and all of that that's encapsulated in the online courses. And at the same time, realizing that at some point, Stu gets to go to the cottage on the weekend and not in another airport flying around. And Joel and I are more than happy to go out and teach these delegates and really empower them to develop the hands-on skills that they need. You're quite right. We've done I think a quite phenomenal job during the pandemic of doing online workshops where I sit and Joel sits and we watch, as we're doing on a Zoom call, the feedback and perfecting and coaching through Zoom calls. But I think we're going to get to a whole nother level again, having the lectures provided ahead of time so delegates can study up and be totally ready for what's going to come in the practical workshops. And I think that's going to allow us actually to teach a little bit more in the practical workshops and extend those out. And I think our delegates are really going to benefit from having more hands-on time, more time to hone and perfect their skills so that they feel like on Monday morning, when they go back to their clinics and gyms and workshops, that they're able to really hone in and start making a big difference in some of their patients and clients Monday morning.
Yes, one of the comments that was quite common from the delegates was they felt rushed with the hands-on skills training. But I think this approach will certainly address that and allow you and Joel just to fly with your teaching skills and making sure they all leave with some of those really honed in, so the delegates know what to do when they get back on Monday morning. Well, with that, is there any final thoughts that you have?
Well, I just look forward to the journey with Backfitpro, and it continues on. And I think we have a model to continue training certified clinicians. I'm so grateful when our delegates enjoy our teaching in courses and want to join up on our team. And then still continue a road to master clinicians who are sought after, and it's so beneficial. And we can't give you enough thanks for all of the work that you've done and started and got everything moving in this whole movement of how to really dissect and drill down on mechanical triggers for back problems that no other profession owns, really. And so it's so beneficial for the patients. And so that's why I'm more than happy to continue to travel around and train as many clinicians as we can who are eager and wanting to learn this information. And I have to say, we have some of the best delegates from around the world who are truly interested in making patients' lives better. And I'm so grateful and thankful for all of them spending their time and money coming to see and train with us. It's no small token of gratitude to thank them for their continued efforts to try and get better. And we're so appreciative of all of them.
Yeah. And the thanks has to go back to you, Ed, for your commitment to, I mean, that PhD, that people don't realize what a challenge that is. It's a terrific milestone. But thanks again for your professionalism, your commitment, and being such a downright good human.
Thanks, Stu, and right back at you. As you know, I appreciate everything you've done for all of us in the world of Backfitpro and beyond.
Okay, thanks so much, Ed. Bye-bye.
Ciao.
Okay, I don't think we need to retake that.
No, I think
First one, that should be good enough. We were right on about 20 minutes. So, oh, I better stop the recording. Sarah will have to cut this last bit out. So stop recording.